Hello everyone, welcome to the Research Data Management course run by NHR Global Health Research Center for Non-Communicable Diseases and Environmental Change. I am Nivedita from the George Institute for Global Health, India, and I'll be leading this module. So the second part of the first session is on questionnaire development, and the session objectives are to be able to use a systematic approach to questionnaire development and be able to recognize ways to minimize data loss and improve analyzability of the data at the time of questionnaire development. So there are two parts to this session. We already covered the first part, and the second session is about steps in questionnaire development. So we saw about there are various goals, irrespective of the type of tool we use. There are various goals for a data collection tool. So it should be able to collect the information which is required to meet the study objectives, at the same time being valid, reliable, and it should be able to generate unbiased responses. The context in which the data is being collected should be captured. It should be easy to use. It should minimize loss of information, and also the queries which can come up post data collection. And the data should be in an analyzable format with minimum data processing. So keeping these goals in mind, let's go to look at the various steps which we might have to follow to ensure that we achieve those goals. So overall, the steps are about, the first step is about mapping about what will be collected, from whom will you collect, how will you collect the data, and when to collect the information. The second step would be, once we are clear about it, to design the form. After designing, it's always important to do some brainstorming with the key team members, and there will be some iterations which might happen. The next thing is about testing the tool in the environment where the tool will be used, and done typically by the field staff, and following which we hand it over to the data management team to design the database so that you can digitize the data which is going to be generated. It is common sometimes we see that we skip from the second step to the fifth step, skipping the third and the fourth step. While it seems like a shortcut, but we might end up spending a lot of time with the data management team. Now, the data management team typically are never by the study, and it's always a central team which caters to various projects. And when that is so, it is very important to give a near finished product for them to develop it in the database. Now let's go and look at each step. So the first step is about mapping. Now, before we start mapping, it is important for us to know something about what should we know before we start developing the tool. So it is important to know the study design. You will always be handed over a protocol or a study plan, and what is it you need to look at? You need to look at the study design. Is it a cross-sectional design? Is it a prospective, or is it a longitudinal? When I say prospective, you follow up the patients and you also measure something towards the end. Whereas in a longitudinal study, you go to the same participants multiple times and capture the same information again and again. Whereas in a serial cross-sectional, you capture one information, but you also again go back, maybe collect the same information, but from a different set of participants in the same area. So it is important for you to know the study design, both to develop the questionnaire as well as when you design the database or give information about how to develop the database. The mode of data collection is important. Is it electronic, paper, or hybrid? May not be important directly for questionnaire development, but it's again important to understand the processes you need to follow, which I'll be discussing further. The administration, is it a self-administered tool? Is it interview administered, or it could be both? Because many a times we see that it might be required that it has to be catering to both the situations. And if so, how do we word the questions? That is extremely important. The next seemingly looks unrelated, but screening criteria from whom you are going to collect the information is important. That's because you will understand the flow of forms, how will you make the form, how will you develop, and what is the information you will put in to understand how a participant moves from screening to enrollment. So understanding the inclusion-exclusion criteria at various levels is important. And then the key study objectives. So the data which answers directly the study objectives becomes critical data. And for any study, there will be critical data, but there will be also some other information which supports the objectives, and those non-critical data should also be identified. So this understanding about what are the study objectives and looking at the data as critical and non-critical becomes crucial at the time of data review, which I'll be discussing more in module 4. So a good protocol should be able to give you these answers. Once you have these answers, then you look for further information, and which is what we call as a matrix. So I'm going to take a simple example which might be more related to public health. And let us say that we are doing a study and there are many clusters involved. And let's say cluster is an administrative area, a ward or a village. And we need to choose, we need to go collect information from many clusters. And from the clusters which are eligible, we collect information from households, and from the households we are going to capture information on mothers and children on some particular households. So this information about what are you going to collect from whom, it should be available in the protocol. So a good protocol again will always have a matrix, and if it does not have, you should make one. That's the first step you need to know. The columns will be from where you're going to collect, and what you're going to collect will be represented as arrows and make a simple matrix. So this is important to get a bird's eye view of what are we dealing with. So as you can see, I don't have to explain here that the cross marks tell you what information we are going to collect from cluster, which is the inclusion exclusion criteria, maybe information from the health worker, a facility assessment, and knowledge, attitude, and practice of the health worker. So this is at the cluster level because I need one information from this cluster. And then so on and so forth from the households, mother, and we have the child. Now, there is more information which we can develop from here. So now I am comparing, I've just converted the previous slide into typical forms. So what are the forms which we are dealing with? So if you see the cluster information, I'm going to collect from the clusters. The information I'm going to collect from the community health workers is a separate form. And then we have the household form, the mother form, and the child form. So you can see an asterisk here, which indicates either the form is conditional or it could be repeated. So if there are more than one children in a family, the protocol says that you capture all the information from all the children. Then it is a repeated form, but it's also conditional that if there is no child, you don't need to collect the form. So some information about, are there any forms which are going to repeat at the same household level? Are there any forms which are conditional that it is possible that you may not collect the form, is also important for us to understand. So those could be written in the footnote. And here the difference between the previous table and the table which I showed here is that the information is now made to seem like a forms. So this is the next step you would do when you are handed over a protocol with the matrix to see that, okay, which information should go in which form. So this is an important step for you to get set started with the form development. And this is what we call as a mapping. Once the clarity is achieved, we start working on the form, individual form. So in the questionnaire development, the first thing is give a name for each form, which should be unique. And if you're starting with a Word document, have a version and a date as a compulsory habit, that you have a version and a date for that particular form, because you know it's going to go through several iterations. The second thing is about, given the matrix or the table which you saw, it will give an overview of what are the key themes which we are interested in collecting. Say I'm interested in the demography, the health history, and exposure of a mother or an individual. Then you start expanding into sub-themes. So within health history, for example, I want to have both medical history and obstetric history. Maybe it is past medical history, past obstetric history, and current health history. You could have several sub-themes against one theme. Once you have a fair idea of you have comprehensively covered everything as themes and sub-themes within a form, then you go about developing questions under each of these sub-themes or themes. When it comes to a particular question, some people call it items, and some people call it fields, it really does not matter. It is one question. So the question wording becomes important and the numbering becomes important here. So as you're developing the questions, keep numbering them, and the chronology of the questions is also something which you might go keep changing and ordering. So be mindful, the chronology of the questions are important. Irrespective of how you plan to present in the final tables, but chronology should be based on ease of administration. Branching of questions, for example, skip pattern is something which you will start thinking at this time. For each of the question, you will have a particular response. So the response are the answers to each of the question and the ordering of the responses. For example, let us say there are 5 choices for that particular question, and then you will have the order in which you are going to place your choices. There might be some way you want to order them, and also the comprehensiveness of the various responses which you might, so that every participant is able to choose one of the response or be able to answer what you are intended to question them. The next aspect which comes in mind as an overview is any instruction which you might want to place within the form. The instructions could be addressed to the person who is administering the questionnaire, or the instruction could be to the participant who is self-completing the questionnaire. The language changes. So any instruction, it is good to have instructions, brief, clear instructions, and as a convention, instructions are generally given in italics. So if there are any instructions, please do add here. If you are going to use a validated existing questionnaire, do not modify and use anything. Just use as it is. Do not change anything. That's one thing. The last aspect is, if you are going to develop a questionnaire in paper and you're going to administer it in paper, then the layout, the font of the letters, the spacing between 2 questions, and the numbering of the questions or numbering of each of the page becomes extremely important. So when you are numbering each page, it's important to use the convention of, let us say there are 6 pages, you might number them as 1, 2, 3, 4, and 5, and 6. But it's also important to know that if you lose the 6th page, and I have no clue how many pages it should have been, I might not even realize that I have lost the last page. So to be clear, it's a convention that you number the pages as 1 of 6, 2 of 6, 3 of 6, and 4 of 6, which you must have seen in the Word format. So these are some general aspects about questionnaire development which you need to be mindful. I will now discuss about various aspects in detail. Now let's come to the themes, order of themes. Now, what is collected? So there is a order which might help, and what should define the order of theme is the ease of data collection. So when I design a questionnaire, I always keep in mind that what if a patient or participant is in front of me? What would make it easier for me to build the rapport? So whatever you're collecting directly from the respondent, keep them first in the order of general questions and then sensitive information. That should help you in defining the theme. The next thing is, I will place something which once I finish speaking and getting the information, now I'll go for the examination part, so that it's much easier that I ask the question, then I say, okay, let's take the examination now. So it could be blood pressure or weight or any other anthropometric measurements you might have in a field-based study. Once this part is done, I might go in to check the medical records. For example, let's say immunization card of a child. I might measure it. So keep it next after the measurements. And then finally, the laboratory data, or I might even consider that lab data may not be applicable for all participants. I might want to have it as a separate form, or I might not get the reports immediately. So let me keep that as a separate form. So the ordering of the themes is based on how we want to go about with the flow of interview. Excuse me. The next thing is about the questions, the wording of the questions. It could be a phrase or a full sentence. So there's no right or wrong here. Age in completed years is a phrase. What is your current age is a sentence. Reason for visiting a doctor is a phrase. What was the reason you visited a doctor is a sentence. However you choose to use, be consistent. If you are planning to have the question either completed by the interviewer or by the participant. It is safer to have it as a question, because then it becomes more personal and it's much easier to give the participant to complete without much of ambiguity. If you use only phrases, then even if it's a field worker who is completing the questionnaire, you might need to do some extra bit of training to make them understand what exactly you are asking. So the general sense is be consistent, either you use a phrase or a full sentence, but be consistent throughout your questionnaire. The next aspect is about the type of responses. So we saw about themes, we saw about questions, now we're seeing about responses. Every question will have a type of response. So the response could be numeric, it could be binary, it could be multiple choice, but where you're picking only one. That is, it's mutually exclusive. If it is one, then it can't be two. It can't be anything else. It could be still multiple choice, but you're picking more than one. You can have multiple choices in that. You might choose more than one response. It could be dates. It could be a text. It could be a short text or it could be a long text. An example for a short text is, what are the medications they are taking? Or what are the other symptoms you have? So a long text is something, what happened when you visited to the hospital? Or what were the events which happened just before death, like a verbal autopsy, or a small brief description which you're asking. So the type of responses should be very clear. There should be no ambiguity of what you are having in your mind, and it should be put in the document, in the form. So the next thing I'm showing an example where you have a question. In general, would you say your health is good? You're asking a leading question and you're asking, how would you say your health is good or not? So your answer could be yes, no, or you do not know. And then you can also have a question with a verbal description along with a numerical rating scale. Or you can have a Likert scale where there is no one directional, it's bidirectional. It's either strongly agree or strongly disagree with the middle category. Or it could be a VAS scale or a visual analog scale where you have given a continuous choice, that is 0 to 100, and people can choose with a description based on the description. So this is more important when you're capturing experiences or perceptions. It's very important for you to be consistent, but also be very clear the way you are developing your responses. There are some more nuances about numeric responses. Numeric responses could be counts, the days you spent in the hospital, or it could be integer in the sense it can be a decimal, like body temperature. It could be an interval or a continuous variable, a blood pressure measurement. The number, with respect to data management, keeping that data management in mind, you also have to be very clear how many characters are you expecting? Are you expecting a decimal or not? So in the below example, in the table, if you see, I have given you that I have put a hash bar where I have put a hash to show that the duration of hospital, it can take single digit or double digit, and the weight, it can take two decimals, 2 digits after the decimal. So this kind of simple explanation will help when you are developing a questionnaire as to what you are expecting. Another important aspect is whenever you have a numeric response, which is a known measure, then having a unit is extremely important. So it should be very clear, are you measuring height in centimeter or height in meters, height in feet, etc. So your question should have the unit embedded within if it is a known measure. When I say known measure, it means you will not have a unit for a VAS scale, as you saw 0 to 100. There's no unit to it, right? So for some measurements, you will have a known quantity, which is a measurement. So you should include the units in that. There are also certain challenges with numeric. If you have missing values or expecting missing values, what do you do? If you expect it to be numeric, but it is possible to have non-numeric entries, such as non-detectable, less than, or more than. And this is a very important aspect in lab measurements. So if you have a qualitative or a quantitative measurement tool, it may not be able to detect beyond a range. So very small values. So it calls it non-detectable. If you have extreme levels, then it might just say more than 400 and not give you the precise answer. So you need to be mindful. There are no one solutions. We can discuss this more during our live sessions or interactive sessions or during our workshop. But these are certain nuances which you should know to be able to handle beforehand when you move your data from paper format to electronic format. The next thing is about binary responses. So what seems to be a binary response may not be always binary. So be mindful, and you might have to account for do not want to answer and do not know. Both are very different aspects of do not want to answer and do not know, and you should know when to put in these or put both of these or either of these. And one more common error which we might come across, and it's more of an oversight, is be consistent with the order of yes and no through the questionnaire. So you add yes and then no, and some places you add no and then yes. So that might be a bit confusing if you alternatively use. So just be consistent with the order in which you place your yes and no's in the questionnaire. Now, a very important aspect about multiple choices. Here I give you an example of a question which wants to capture the type of fuel for cooking. And there are multiple fuels which are shown here. And I also want to know if they're using a biomass, what type of biomass fuel they're using, and also an option for specifying any other things. If you see here, I've given radio buttons here, which means I can choose only one. It's a mutually exclusive, which means if I choose electric, I cannot choose anything else. It is possible that I'm using both electric and natural gas, or I'm using biomass and natural gas. It's quite common where people use two types of fuels in a household for cooking, especially in the rural areas. So it's important for us to be mindful that is it truly mutually exclusive? Does our question or the design allows us to capture more than? Are we only interested in mutually exclusive? Then the wording of the questionnaire should change, that what is the predominant fuel you use for cooking? It still could be challenging. What if somebody uses 50% of times biomass and 50% of times electric? So the solution is go for a better question design. So let's see, based on my supervisor's comment, I worked on it, and here I go with a questionnaire where it allows me to choose more than one choice. So I'm happy it can give me more, I can check more than one boxes. But I also say, okay, I think this is also one method where some people can come with this method where I have a question and I have multiple choice where I can check more than one box, or I have a drop down like in electronic forms where I can choose more than one choice. Now there is one more thing which I've added in this slide, which is the column. So now when you get a response and you want to know what are all the various fuels people are using, you expect multiple columns in your data set. One column for biomass with an answer yes or no, electric yes or no, natural gas yes or no, plastic yes or no, which means your question number 8 has 4 columns. Your question number 8 in the second method, in this method, will have just one column, and all the responses will be dumped into one column, which typically makes it unanalyzable, which I will explain to you more when we meet in our live session. So this particular option is a big no. This option should never be used, and this is because though it allows you to capture more than one, it is easier at the time of data collection. At the analysis stage, it is very difficult, and it's not possible. It's very difficult to analyze. There is a drawback with this method as well. Let us say the answer they mark biomass, and the rest of it is and then I write dried down here, and everything else is not completed, which means it is no, because they have not marked it. But it is an assumption that if you have not checked, it is a no. It is also possible that they missed it. They did not, by oversight, they missed to respond. So there is a risk of confusing for missing data with a no negative response. So this again is not the best choice. So what is the best way to do to handle such a situation? So have a question where it gives you clearly, makes each of the section mandatory. Either you mark an S or a no. So there is no way you want to leave the question. So you know if it's either used or not used, and each of the aspect will come in separate columns. So here the assumption is all items fields should be completed. You make them mandatory fields. That's the one important thing which you need to do. So just to summarize, we saw about numeric responses, we saw about binary responses, we also saw about multiple choices where you want it to be mutually exclusive, or if you think it cannot be, then you also have a multiple choices with multiple check yes no options. Now you can also see an other specify column here. While other specify is important, as I said, if you do field testing or if you have experienced members in the team, you should put as many choices as possible and reduce the number of responses you will get from other specify. That's because again, texts are always difficult to analyze. So the next type of response we might get is a date. This is straightforward, seems straightforward, but most of the time the most troublesome one when we analyze the data. So use a consistent format, date, month and year. You have to be clear, do you want the time? If you want the time, which format are you going to use? 24-hour format or a AM PM format? You want to want the precision by minute and seconds? Is it needed? If not, you don't need to measure. And accounting for how do we capture if we do not know? So missing data is always a challenge when we are designing forms, which we need to be mindful to discuss with the data-based design team to give us solutions for that. So the next aspect is about how can we minimize loss of information at the time of designing our questionnaire. So there are certain responses which can be given as a continuous response, or like years or months, or you can have them as categories. At any point of time, continuous responses are more rich when compared to categories. You lose information when you categorize responses. Let us say I'm interested to know what is your duration you had symptoms. Let's say cough. So you might want to be knowing, you want to categorize them ultimately as less than 1 year, 1 to 2 years, and more than 2 years. But that's what is your interest. You might collect directly this way, or you might collect when did the symptoms start. So, and you want to do it in months. So this one will allow you to capture as fine as, let us say your supervisor says, I don't think 1 year is good. We need to have at how many people had less than 6 months. If you end up collecting this way, you may not be able to go back and get the answer. But if you collect the answer as continuous variables, you will always have option to categorize it the whichever way you want. And similarly, anemia. You collect it as hemoglobin raw values, or you collect it as various categories, which obviously will choose the hemoglobin value if we are having the data. So this is about minimizing loss of information. There is also another way where we might lose information, the way study was conducted, and which a good smart tool might help us. So there are two forms where this can be an issue. One is a screening form. As I said, we want to capture eligibility criteria, but we also want to know why someone became ineligible, and we also want to know why someone is eligible and not participating. So this type of question should be added, and we should collect it so that we get a rich information about if there is any chance of selection bias. Similarly, for the follow-up forms, if a reason, if a visit was not completed, it's important for us to have some indication as to why the form was not completed. If when the patients or the participants are being followed up, it could be any reason, but try to collect as much information as possible. This is important for us to know, to reduce um, uh, to and fro queries to the field staff, And it is also important to identify remedial measures so that we can ensure we have minimal loss of information. So we once we have, so some I have given you some, I won't say that I've given you comprehensive information, but some key things which you should remember when you're developing your form, you're ordering your themes, you're developing the questions, the type of responses, and how you code the responses. Brainstorming is extremely important for any activity. It is time consuming. At times it might add multiple layers to your work, but having multiple iterations is always a good thing to get the good work done. So how do we do this? Uh, so there is something called a dummy table or a shell table. So whenever we have a data, we ultimately present it as tables, summaries. A researcher will clearly know what is exactly they would like to present at the end of the study, or you might choose examples of existing studies to say, well, this is how I would like it to be presented. So developing a dummy table or a shell table for a given data at the very beginning of your study is a good practice. Once it is done, you might map the questions to see if your questions in the questionnaire is able to give this table in the future when you are going to analyze, or you can use that table as a starting point for developing your questionnaires. Uh, Either way is fine. But now, why is it? In what way does it help? I'll show you an example of how a table can get translated to a questionnaire. So let us say that you have a table, and this is what it might be from a table from a previous study as well, or you might say, it's very easy for researchers to think in terms of a table rather than in a questionnaire. And this is what you're given, that this is what you want the information as. And you also are told that I want to know the information for reason for exclusion from the numbers who are approached and numbers who are completed. So you look at this table and then you set up a questionnaire. So as you can see the difference, while I present it as categories, I have it as a continuous variable. You know the reason why. You have the gender and you also are capturing gender not in a binary fashion. Illiteracy, you followed the definition here as per what is mentioned here, and the years of schooling in a continuous form. And you already saw how this particular information could be tricky as to the type of fuels which are being used. So a table will make it very clear that these two are linked, and let us say that uh, some information is there and that information is not there in the questionnaire, or it is there in the questionnaire but it is not there in the table, the final tables. It will help make you think, oh well, it's not even used for your data, it's not even your supportive data, I'm not sure why we need to collect, let's reduce the question numbers. So it will help you to reduce redundancy. So the summary is, it dummy tables helps you to develop the questionnaire. It will also help you to ensure critical variables are actually collected, helps you to remove redundant questions, and it's a bridge between the study protocol, which is typically written by the research team, the PI, the tools which are developed by a wider member of the research team, and the analysis which is done by the statistician. It's an excellent tool to put everything in one place. So it is a good practice, especially in clinical trials as well as in large epidemiological studies. It's worth spending some time in making the tables and ensuring that all the information in the tables are collected in the questionnaire. So who does the team review? The team review is done by the research experts. The subject experts are extremely important. It could be a clinician, it could be a nutrition specialist, it could be an environmentalist, it could be a combination of all. So subject experts are very important to have a look at the tools. A project manager will have a wide experience, especially field experience, and they may also know about existing tools which they can repurpose. A data manager will look at it in terms of, if this tool becomes a data, I have to develop a database, they will be able to give advice based on the challenges which they might face during the database structuring, or It will also help them to identify some checks which they will have to develop, or it might be helpful for them to tell such a check is possible or not. A statistician, they are very crucial for them to review so that they know that the data will come in the format which is possible for them to analyze, as well as they will be they will really be able to understand the dummy table or map the dummy table with the questionnaire, or even help you with developing the dummy table. So a team review is important and brainstorming is important. Before you move on, there is one more step, which is the testing the tool by the field staff. So in spite of everything, until this questionnaire is tested in the area where it is ultimately going to be administered, it is still half job done. So the insights which you might get from the field staff or the end users is extremely important. There could be two things. One, either you're going to go for a paper data collection or you're going to do electronic data collection. Either way, pilot testing helps you. With paper data collection, it's better you do this pilot testing before you do a large scale field staff induction and you finalize your manuals. It also helps you to reduce the other specified options. As I told, it is good to have as many responses as possible falling into this category. It might pick up some ambiguous wording of your questions, and it will help you to finalize your tools before this paper form is handed over to the data management team to design a database for data entry. So pilot testing is always useful. Though we say that, oh, it's a paper form, even if something is wrong we can always scribble at the side of the paper and get it corrected, but it's always good to do the testing to be consistent, especially we have a large field staff working in multiple clusters. Consistency is important, so pilot test is crucial. If you are going to do with electronic data collection, always and always do a pilot testing before you hand over the tool for database design, because you are going to capture directly data from the electronic from a tool, from a computerized instrument. So user acceptance testing is also important, but before the pilot testing of the tool is important. Now, these are some of the steps which will help you to achieve this goal. This I hope you know you're convinced about the reason how the steps will be helpful for you to achieve this goal of collecting all the information, relevant information, making it easy for data collection, minimizing errors, and also make the data in the most analyzable form. Now, the next step would be to hand over this questionnaire to the database designing team. But before you hand it over to them, there are some steps which you might have to do as a researcher. And that's what we are going to see in our next session. What should you do before you go hand over your tool to either to make a database for electronic data capture or for data entry following a paper data collection. So thank you for listening.